Hello, everyone. I'm glad to share how nurses effectively advocate for change in a hospital environment. My name is Hsiu-Hung Wang. I'm currently the professor of College of Nursing, Kaohsiung Medical University, and the president of Taiwan Nurses Association. Over the past decades, I have been the director, dean, and vice president of the Kaohsiung Medical University and deputy minister of the Department of Health. I have received some national and international honors or awards, such as Fellow of American Academy of Nursing and International Nurse Researcher Hall of Fame from Sigma. More recently, I received Mary Tolley Wright Award for Excellence in Leadership from Sigma. This micro-learning section will demonstrate the steps nurses take to effectively advocate for sustainable change. The learners will know how to implement the strategies for effective advocacy and have the concept to promote the preparation and equipping of the health system to respond and meet the needs of the public. First, I would like to briefly introduce the Taiwan Nurses Association. TWNA was founded in 1914, joined ICN in 1922, and is the only association representing Taiwan as an ICN member. It is the longest-running nursing organization in Taiwan, with more than 75,000 members. The aim of TWNA are to promote nursing profession, upgrade nursing education, improve nursing research, promote people's health, and enhance international influence. As a nurse advocate, it is important to increase your influence in the hospital to make changes. There are some steps and strategies to take effective advocacy for change. Professional commitment is the first step to show your willingness and passion to be an advocate for change. Building your professional image can earn the trust and credibility from the patients or the hospital. Taking any opportunity to voice for nurses, patients, and the public. Enhancing research capacity and applying evidence-based practice in the hospital. Writing articles or holding press conference to advocate for the nurses and patients. Actively participating in policy-making process and politics. And finally, leadership knowledge and skills are more important for a nurse to be an effective advocate. The most effective strategies to advocate for change are strengthening leadership knowledge and skills, and actively participating in policy-making process and politics. The involvement in policy-making process and politics are important in hospital environment to increase the influence of nursing in hospital, strengthen mutual, multiple reciprocal relationships and partnership with policymakers and stakeholders in a hospital, increase the opportunities to advocate for nurses, patients, and people's rights, safety, and health, and expand leadership. There are some reasons for nurses to cultivate their leadership, including nursing is a dynamic and challenging profession requiring engaging and inspiring role models and leaders. Leadership is the foundation that brings an organization's mission and vision to fruition. Leaders empower others, inspire innovation, and challenge traditional practices. Leaders lead changes for good, including nursing itself and nurses themselves. Leaders affect organizational changes and improve quality, integrated, and people-centered care. Leaders influence policy to advocate for nurses' rights and patient safety. To cultivate more nurse leaders to be effective advocates and improve quality care in hospital environment, Taiwan Nurses Association has started leadership programs for different levels of nurses for over 10 years. Since 2009, we launched a variety of leadership programs from senior and young nurses to student nurses. The aims of ICN GNLI mainly focus on influencing policy, working with stakeholders, negotiating with policy stakeholders, framing the evidence base, and appealing to politicians, policymakers, and the public. So far, we have sponsored 12 senior members and 10 nurse leaders from other countries to complete the ICN GNLI program. Since 2011, we launched the Nightingale Nursing Leadership Institute to cultivate more nurse leaders to participate in policymaking and politics. Until now, there are 240 members completed the program. The NNLI program has transformed the participants. A hospital supervisor, Dr. Lin, said, "I never thought that I owned an influence power until I participated in the NNLI program. Now, I become more active to maintain our nurses' rights and benefits by attending various meetings and negotiate with hospital authority and medical teams." A hospital deputy superintendent, Dr. Wu, said, "As a leader, we have responsibilities to lead our nursing toward a better future. Through NNLI, I realize and fully understand that leading changes and influencing policies by nurses definitely possible if we are committed to doing so." Another leadership program is the ICN Leadership for Change. The aim is to prepare nurses with the leadership skills required to implement organizational change, to improve nursing practice, and to achieve better health outcomes. TWNA launched ICN LLC in 2015 and currently is the only national nursing association certified by ICN to lead LLC program by certified trainers. 13 LLC trainers from TWNA are available to provide regional training in Asia. In 3 LLC cohorts, there were 64 participants, including 49 from Taiwan, 9 from Myanmar, 4 from Indonesia, and 2 from Vietnam. The report of LLC program in TWNA was documented in the ICN website. The LLC program has transformed the participants. Dr. Lin, an associate professor, said, "I have learned the importance of leadership from activity in LLC. LLC helped build up teamwork and gave me confidence to overcome challenges and make differences." Dr. Dai, a supervisor of a medical center, said, "LLC helped me boost self-confidence, increase courage, grab chances, and advocate for nurses and patients to make changes in hospital." Dr. Dai has been to Sigma headquarters for internship. He also said, "After the internship program at Sigma headquarters, I have much more confidence in advocating for the nurse and patient." Next, I would like to share the TWNA's role of an advocate during the COVID-19 pandemic. During COVID-19 pandemic, TWNA on government to terminate or postpone large gatherings to prevent the collapse of health system in the beginning of the pandemic. Assured health system to provide adequate supplies of PPE, safe staffing and compensation, and protect safety, health, and well-being of clinical nurses and patients. And I was interviewed by the TV channels, Ministry of Health and Welfare, and international media to advocate for frontline nurses. I also had opportunities to advocate for nurses and patients via a variety of international platforms, such as ICN COVID-19 webinar and WHO ICN-ICM Triad virtual meeting. On May 12, the International Nurses Day, the nurse leaders met with National President Dr. Ing-wen Tsai in the presidential office to advocate for nurses' rights and patient safety. And I represented all nurses to receive an appreciation memento with the words of, "This country is great because of you," from Taiwan President in the presidential office. In conclusion, 2020, the International Year of the Nurse and Midwife, is a unique opportunity for nurses to expand more significant impact and advocate for the health of the world. Although COVID-19 pandemic is a crucial challenge, it is also an opportunity for nurses and leaders in hospitals to advocate for more investment in nursing, enhancement of nursing image, nurses and patients' rights and interests, engagement of policy making, and political influence. To appreciate and advocate for nurses' contribution, TWNA has collected photos and stories related to COVID-19 containment efforts and issued a book, Proud Nurses on the Front Line of COVID-19, Our Experiences, Our Stories. Thank you for your attention.